Hello, welcome to my Module 4 hackathon project, and this is PlainMed. So PlainMed rewrites clinical text into plain language. It is a fine-tuned Quinn 2.5 LoRA model that turns medical text into plain language. So in the application, the fine-tuned outputs and the base outputs are shown side by side so that you can see what the model learned. A little bit of context for the project. Most people, when they receive a discharge summary or a lab result, look through the clinical data and lab information, have absolutely no idea what it means and struggle to read what the language says. So this model basically translates tough to read clinical jargon into plain language. So here I fine-tuned a Quinn model on pairs of clinical sentences and their plain language versions so that it could differentiate and understand the translations. So I trained the model with a Google Colab GPU tier, and then I downloaded that model onto Hugging Face Spaces and uploaded this application here. So if we take some of these examples here, such as the patient exhibited postprandial hyperglycemia refractory to oral hypoglycemic agents, and we just click that here and then click rewrite, we will see it processing through both the base model and the fine-tuned model. Takes around 8 seconds, and then we can see it here. So on the left, it says the patient had high blood sugar after eating food they couldn't lower with medicine. And before fine-tuning, it says the patient had high blood sugar after eating food they couldn't lower it with medicine they take. So it's a little bit harder to read, harder to understand this. But after the fine-tuning, it is a little bit more easy to read, a little more simpler, easier to digest, and much more plain language here. So another example, we have serial troponin measurements were obtained to rule out myocardial infraction in the setting of atypical chest pain. Put that here and rewrite it. It processes through both sides of the model. See, the doctor took repeated heart tests to make sure there wasn't a heart attack when someone had unusual chest pain. And the base model before fine-tuning is much more elaborate and probably even more complex to read. So we can see clearly that after fine-tuning with the clinical text pairs, that the model is much better able to translate the medical jargon into more easy to read language. So I hope you enjoyed this hackathon project, and thank you very much for tuning in.